Hi guys, welcome back to another video at the AAFE Training Center. Today I'm doing a little bit of a newer treatment that's offered in aesthetic medicine, and that is a treatment called SkinVive. So SkinVive is actually considered an injectable moisturizer. So although it looks like a filler and it's in a syringe and it has a needle, this is a completely different type of product. And it only lasts about 6 months. So this isn't going to be your typical 9 to 12 month filler, and it is going to last 6 months. And we don't normally say anything longer than that, just because that is what the studies are showing. So all this is doing is holding on to more hyaluronic acid in the skin, and it really doesn't have any filling capacity to it. So if you've ever seen SkinVive done, or you've seen a video on social media where somebody is injecting SkinVive just even on their hand or on their glove, you can truly really see how thin the product is. It is almost like water. So even though it looks just like other products in the syringe, it's very, very different in what it's capable of doing. It's very different in its viscosity. And again, it's more consistent with a water than it is a filler. It's very, very thin, and you can pretty much kind of smooth it out very quickly, and it kind of disappears. So it almost smooths out like a moisturizer, so that's a great way to kind of tell patients it's an injectable moisturizer. It is not a filler, and all it does is basically add more hyaluronic acid to your skin. So we explain it to patients as creating more aquaporins, and aquaporins in the skin hold on to hyaluronic acid. So if you have more of those, you have more capacity to be hydrated. So that is the beauty of SkinVive. You can, if you're newer and kind of new to doing the treatment and performing it on patients, you can kind of mark up where you want to inject. But it is supposed to go in a certain area of the skin. So you do want to be careful on your depth. And you couldn't see it on the video, but I do switch my needle a lot when I'm injecting this. It's a very, very baby needle, so you do have to give a lot of oomph when you're pushing, because it does feel pretty thick, even though it isn't. It's just big syringe, small needle. So you do have to give some pressure when you are actually injecting it. So for her, I'm just kind of working my way around the face, very, very small boluses, and I'm just getting underneath that tissue. If I see any lumps or bumps in the skin, I want to smooth that out before she leaves. And I'm just checking depth and making sure that I'm doing a good job with my injections. So I'm on the other side of her face now. Her goal was to add hydration, especially we're in Cleveland, Ohio, so especially going into the winter months. So for her, that's exactly what we did. And you can see kind of too, as I'm injecting, you can start to see that needle get more and more dull as well. So the needle comes with the syringe comes with 2 needles in the package, but they also ship a lot of needles with them, which really, really helps because you can use upwards of 4 to 5 needles per syringe. So just keep that in mind. It will make your patient more comfortable if you continue to switch out that needle. Also keep in mind, I did numb her. Not a lot of people do this because there is lidocaine in the product itself, but I want my patients to feel as comfortable as possible. So I did numb her topically beforehand. So keep that in mind. That was something that was also done prior for about 20 minutes. And see how I just kind of made sure everything was smoothed out. If you are a little too superficial, I just wanted to kind of scrape it with my finger and make sure that I work out any lumps and bumps. So that's what I'm doing with her, and you can see how comfortable she is during this treatment as well, which when my patients are comfortable, I'm more comfortable. So yeah, overall SkinVive, really cool treatment. Very safe, effective, lasts 6 months, and patients are very happy with the results. It takes about 2 weeks to kick in. And you can pretty much put it anywhere. You just have to be really careful with the depth and if somebody's a good candidate or not, or if there's anything going on with their skin. But overall, I really like this product. And you can see I'm just putting it in her nasolabial fold and marionette here too to help give hydration before we go into the winter months. If you have any interest in learning this, if you're a member, you can jump onto the community site forum and ask some questions about it. And you can see a little swollen and bruised, but nothing crazy, and that can linger for up to 2 weeks.